I'm Ruth O'Regan. I'm a professor and chair of medicine at the University of Rochester. Trastuzumab has been highly effective in treating HER2-positive breast cancers, but unfortunately, we know that some patients with HER2-positive breast cancer, their tumors become resistant to trastuzumab. Now, the mechanisms behind this are not completely understood, but there is some data suggesting that other growth factor pathways may take over the cancer cell and start driving it rather than the HER2 pathway. There's also been noted alterations in the HER2 gene itself where there's truncated forms. The good news is, however, is that a number of the HER2-directed agents we have appear to work very well in trastuzumab-resistant breast cancers. Just to go through the armamentarium of new agents that we have for HER2-positive breast cancer, they include tyrosine kinase inhibitors such as tucatinib and neratinib, antibody drug conjugates, including trastuzumab DM1, and then more recently trastuzumab deruxtecan. And all of these agents actually have been studied in cancers, or in patients rather, that have metastatic HER2-positive breast cancer that have been previously treated with trastuzumab. So we would assume that those patients have trastuzumab-resistant cancers, and each of them have shown quite considerable efficacy in that group of patients. So it appears that although trastuzumab resistant is something that certainly does occur, and we know really resistance occurs to almost all the anti-cancer agents that we use, there are all these new agents essentially that really can be utilized to treat patients with trastuzumab resistant cancers. Now, the other question really is there are there cancers that are de novo resistant to trastuzumab? So in other words, are there cancers out there where trastuzumab doesn't work at all? And I think the answer to that is yes, but thankfully it's probably a minority of cancers. And I think one of the ways you can look at that is, we use a lot of preoperative approaches for patients with HER2 positive disease. And the majority of patients do get a pathologic complete response to trastuzumab-based treatment. However, there's a subset that do not. And obviously, the thought would be that some of those cancers will be resistant to trastuzumab. On top of that, there also is a very clear link between the HER2 pathway and the estrogen receptor pathway. So what we know is that cancers that are HER2 positive and estrogen receptor positive are less likely to get a pathologic complete response from trastuzumab-based treatment. We're not exactly sure why that is, but it appears that there is marked crosstalk between the estrogen receptor and HER2 pathways. So if you only target one of the pathways, you allow the other pathway to act as an escape or resistance mechanism. So there is some interest in kind of dual targeting estrogen receptor and HER2 as a means of overcoming resistance, but also potentially de-escalating treatment in some patients.